Okay, Senator, can you tell, you had a major accomplishment today, I think, on the floor. Can you explain what happened?
Sure. What we did is we passed out the autism insurance coverage bill for the second time this year and sent it over to the Missouri House, which will provide insurance coverage and proven treatments and therapies for kids and families dealing with autism.
Okay. Um, for people that don't watch politics all the time, can you explain why you had to pass two bills?
Sure. Earlier this year, we had passed my bill, the Senate version, and sent it over to the Missouri House because they have to go through their process as well and weigh their thoughts on. They had passed a version of it and sent it over to us, and then we had tweaked it and had some compromise language between the two versions. So now both of those bills are back in the Missouri House, and they just need one vote, or actually the one bill needs one vote, and then it goes to the governor's desk, and we can affect the lives of thousands of Missouri families.
So this most recent bill has had the most compromise work done on it between the two houses of the legislature. Is that correct?
Yes, we've been we passed this bill out of the Senate last year, and it died in the House. So we spent all last summer working on it, plus all this session working on the different ideas and the versions with the autism advocacy groups, along with the insurance industry and small business owners and the Department of Insurance. So what we passed out today was what we think is a very good compromise bill between all the different parties. Now, some don't want it and some don't like it. The insurance industry still isn't a fan of it because they have to start providing the coverage which they should be doing. But what this does, it represents a lot of people's efforts and time and consideration in moving that ball forward.
In a nutshell, can you explain some of the what the bill carries in terms of advantages for coverage and then also some of the costs?
Sure. I mean, what the bill basically says is that you're no longer going to be discriminated against if you have a diagnosis of autism in your family. Because currently now the families were being denied coverage for basic medical sometimes, and some of the proven treatments that really affect the kids and have a lasting impact over the life of the child. They're being declined coverage, even though autism is a disorder or something that is just like a neurobiological disorder like Lou Gehrig's disease or Alzheimer's, which are all covered by insurance. So this is just bringing parity to this to autism like the other ones that are treated. And the cost is really what we've seen in other states is very minimal to insurance policies. The actuarial data that we have used showed that across the state, if this were to be enacted, premiums on insurance would only increase by 0.25%. So it's not the huge sky is falling that the insurance industry has been saying. And really when it gets down to how many kids are being affected, 1 out of 100 kids, according to the CDC, is being diagnosed with autism. We can provide life-changing therapies that save the state, your school districts, and the taxpayers money long term for this minute little bit of an increase.
Now, was I reading the fiscal note correctly when I saw it would be about 450,000 to 800 and something thousand over the next 3 years cost incurred to the state?
Yes, because we were providing the same coverage to all the 60,000 employees of the state, and so in our health care plan, we factored that in as well, and that showed a 0.25% increase across the board when we looked at the thousands of families in Missouri that would be covered under this. So when you look at it, it's extremely minimal.
Oh, I guess I didn't realize that. So what that fiscal note represents is the state's cost of insuring its own employees' kids with autism.
That's correct.
Interesting. And then finally, you had also noted that, or there was a note if small businesses incurred too much of a premium increase that they could opt out. Could you explain
Sure.
that?
We were very concerned anytime you add any type of an increase to small businesses and the cost of doing business. And so we have a trigger clause that if a small business in Missouri, which is 0 to 50 employees, if their insurance premiums increase by more than 2.5% in 1 year because of this new coverage, then they can petition the Department of Insurance and say, look, our insurance costs went up more than 2.5%. We want to be exempt from this because it's making our premiums go up too much, and they have that ability. And we were very confident in putting that in, and we've done that in similar legislation in the years past to protect our small businesses, because it gives them the opportunity to say, hey, if we don't have anyone that needs this coverage and it's driving up our cost, give us an escape clause, and that's what we did.
Then finally, what kind of indications are you getting? What do you expect to see from the House as we move forward in terms of, is this thing actually going to pass this year?
Well, the House voted on something similar and passed it 138 to 19 or so. So there's overwhelming support. The question is, will the leadership, allow it to come to a vote, and when will they allow that to happen? Last year they didn't allow that to happen. They've been doing some maneuvering this year that kind of gives us an indication that we're going to maybe see a similar fate. So we're just really reaching out to all the families across Missouri to positively ask their state representatives to, hey, please vote on this. This is something that's important to us. Ask your leadership, of which you elected, to listen to our voices and give us an up or down vote on this. Don't just bury it or just wait until time runs out.
Very good.
Great.
Well, I appreciate your time and
Thank
explaining
you
this to
much.
me.
No problem. Very good. Thank you much.
Mm-hmm.